Degenerative disc disease is a very common cause of back pain. By the age of 35, approximately 35% of people will show evidence of disc degeneration. By age 60, more than 90% will show some evidence of disc degeneration. Our spinal discs eventually wear down. And in fact, it's just one of facts of life. But this doesn't mean that you can't still lead an active and relatively pain-free life. Today, we are going to highlight the symptoms, discuss some of the treatments, and answer any other questions you may have on the episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I am Dr. Georgiy Brusovanik, a minimally invasive spine surgeon, and today we are talking about degenerative disc disease. Our first question of the day comes from Vita from Facebook. Do you have any tips for improving sleep posture to help my back? I wake up every day feeling sore. I'm a side sleeper. Vita, thank you so much for this question. This is a super common issue because so many patients who have degenerative disc disease wake up a bit flexed forwards. It takes them a few seconds to really stand up straight. And usually those first few moments when they wake up, they're in pain. So it is natural to try to blame the way you sleep. Unfortunately, we can really only control how we go to sleep. We can't control how we actually sleep. We all toss and turn. And if you are waking up in pain, that's a sign of a strong inflammatory response deep in your spine. So if you're waking up in pain, don't blame your mattress. We just published an article in GQ on mattresses and in Forbes magazine on pillows. And I was disheartened to tell the readers that it is not the pillow or the mattress. It is not how you sleep. It is an internal problem. So if you're waking up in pain, I would get an opinion from a spine specialist. Thank you for your question, Vita. Greta asks, please feel free to log into allhealthtv.com to post questions. We have a Facebook account as well, a YouTube account. Please don't hesitate. So Greta asks from allhealthtv.com, Dr. Brusovanik, I've been struggling with back stiffness and pain for a while now, but it's gotten worse over the last few years. My primary care physician told me that he thinks I might have degenerative disc disease. What is it exactly, and what can I do to feel better? Greta, thank you for sharing your story with us. I'm happy to talk about degenerative disc disease, but before I do, I highly recommend that you meet with a specialist, an orthopedic surgeon or a sports specialist who could confirm the diagnosis and then recommend treatment. So, what is degenerative disc disease? Well, we have discs that separate the bones in our spine, and as we age, the discs dehydrate, degenerate, become shorter, become wider. So that change that inevitably happens in all of us results in a painful response as our posture changes and as we start to irritate nerves that course right behind those very degenerative discs. Now, it's not a dangerous problem, but if you are suffering and you're waking up flex forwards, if you're having sciatica, then you definitely don't have to live in pain and you can get better, not necessarily with surgery either. Last but not least, I've included a list of common symptoms of degenerative disc disease. So, common symptoms. You wake up in the morning and you get out of bed, and pain is just worse when you're sitting. While seated, the discs of the lower back have 3 times more load on them than when standing. Pain gets worse with bending forwards. A lot of patients will have a real difficult time bending forward to touch their toes. Lifting and twisting may be difficult as well. Now, feeling better while walking or even running is not uncommon. So sitting is difficult, but standing sometimes gets difficult too. So many patients will say, when I'm in the kitchen, I bend over, this pain starts to build, and I sort of have to sit down. Periods of pain that come and go is typical for degenerative disc disease. These can last from a few days to even a few months, and they range from nagging, disabling pain, affecting the lower back, buttocks, thighs, and if you have degenerative discs in your neck, it may cause neck pain and pain going down the arms as well. Numbness and tingling starts to occur once those nerves are further compromised. And finally, when the nerves are truly compressed, we can see weakness in the legs or arms, even something as bad as foot drop from damage to the nerve root. Our next question is from Augie, who reached out to us through YouTube. Hi, Dr. B. Do you mind if I call you Dr. B? Because if you do, I get it, and I won't do it again. Augie, you can call me Dr. B. A lot of people call me that. My name is difficult to pronounce. Anyway, I'm supposed to get back surgery soon, but they want to know if I want open surgery or the kind that you do, minimalist something or other. I think you mean minimally invasive spine surgery, Augie. Can you tell me what is the difference? I would love to. Thank you for reaching out, Augie. So, classic spine surgery versus minimally invasive spine surgery. Classic spine surgery attempts to get to your back via big open wounds. Usually that means all from the back. Now, your back muscles end up getting stripped off the bone, and that causes significant disability. Also, by trying to reach the nerves and the spinal bones from the back, you end up causing a lot of trauma. Now, minimally invasive surgery uses techniques like little tubes, specialized light, specialized navigation, which lets us see where we are without having to open the patient up in a big way, like with open spine surgery. So really, minimally invasive spine surgery is an attempt to accomplish the goal of surgery without the trauma of big, wide open spine surgery. I think you will see most younger spine doctors these days doing surgery these ways, but definitely inquire from your doctor if what they're doing is truly minimally invasive. The next question is one of my favorites. I get asked about it all the time. It comes from Alexi, who just texted us from Facebook. Hi, doctor. I hurt my back at work a few weeks ago. Like an idiot, I was lifting heavy boxes with my back instead of my legs. Alexi, I don't think you're an idiot. You just have to lift heavy things sometimes. My back went out, and I was in severe pain. I was lying on the floor of the warehouse for almost 2 hours. Poor guy. My lower back, it still hurts, so I went online to try to figure out what I did to my back. I've narrowed it down to two things: herniated discs or degenerative discs. What do you think? Alexi, I get asked this question all the time. Now, I obviously can't diagnose you over the phone for obvious reasons, but before I give you a quick tutorial on both disorders and share my opinion, I highly recommend that you make an appointment with your primary care physician. So, degenerative disc versus herniated disc. They are really shades of gray. Now, discs degenerate with time. Part of that degenerative process may involve where a disc tears and a piece comes out, a little piece of nucleus or the inner part of the disc. As you bend forward to lift that heavy box, you put a lot of pressure on that disc. And if a big piece of disc sneaks out, we call that a herniation. But a herniation is a big step towards degeneration. So theoretically, the name of the diagnosis doesn't mean as much because the pain is the same. It's back pain and pain going down the legs. But you should know, in general, we reserve disc herniations to diagnose younger patients and those who have symptoms that last less than 6 months, versus degenerative disc is where pain comes and goes, and oftentimes lasts for years. Sometimes it goes to no pain, but a lot of my mom patients, young moms especially, will say, when I ask them, when was the last time you actually remember being without pain, they'll cry because they say, I can't remember. Now, that's a degenerative disc complaint. In case you missed it the first time, here's another opportunity to find out where to send in your videos.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back to Ask the Doc. This question comes to us from Douglas, who reached out through YouTube. Hi, Doc. I finally caved after years of back pain and went to the orthopedist. I was diagnosed with stage 2 degenerative disc disease. The doctor was going to discuss the diagnosis, but he was called away on an emergency. He was supposed to call me, but that was over a week ago. Do you mind explaining the 4 stages to me, especially stage 2? Absolutely, Douglas. So these stages are really coming to us from imaging, from an MRI especially. An MRI is a study where we can see the soft tissues, the discs, the nerves, and if you have back pain, then you really should consider asking your doc to get you an MRI. So stage 1 of disc degeneration is where the disc loses its ability to retain water. Just like cartilage, the inner core of the disc starts to dehydrate and lose height. You develop tears or fissures on the outer periphery of the disc called the annulus, and the outer layer may even allow the inner content to sneak out. And remember, if a big piece sneaks out, we call that a herniation. Now, stage 2, Douglas, that's prolapse or a bulging disc. So imagine a disc is like a jelly donut. It's not really like a hockey puck. It's more like a jelly donut, where if you keep putting pressure on it, it gets wider and wider and gets smaller and shorter. At some point, the jelly may even start to come out. So the bulging disc is before that jelly comes out. As the disc starts to bulge towards the potential space behind where the nerves course, the inner core of the disc may cause the disc to bulge out. This can put pressure on those nerves, even the spinal cord, and this may cause increased pain and discomfort. That same old, I wake up in the morning, flexed forwards like an old man or a woman. When I have dinner, I have to keep fidgeting, changing positions. Sitting in the car is painful. That is that early disc degeneration. Now, a ruptured disc, which is stage 3, is also known as a herniation. So in this stage, the outer layer completely tears and the inner content sneaks out. So this is commonly known as a herniated disc or a slipped disc. Severe pain, other symptoms may ensue, not always, but if you feel numbness, tingling, or weakness going down your arms or going down your legs, your thighs, then most likely there is a disc herniation. Now, stage 4 is severe stage. In advanced stage, the discs may lose a significant amount of height. You find that you are almost always flexed forwards. You wake up flexed forwards, you get out of the car flexed forwards, and to compensate for the loss of disc height, the body may start to create bone spurs, which essentially, when you get inflammation around the disc, eventually that inflammation turns to bone. Now, if nerves course right behind those discs, then those very bony osteophytes or spurs start to cause narrowing in the channel where the nerves sneak out. And that's how you get that constant severe leg pain. Okay, we got another question from allhealthtv.com. You should really check this website out. It has a chock full of great information, and you can post questions for us to be able to answer, for me to be able to answer. Okay, so this question is from Anastasia, who asks, Привет, Dr. Brusovanik. I guess Anastasia speaks Russian. Привет is how we say hello. My back has been bothering me for a number of years, and it finally got to the point where I had to see a doctor. I was diagnosed with degenerative disc disease, and he said I could do one of two things: get surgery to fix the discs or go to physical therapy. I'm not ready to go under the knife just yet, but I'm not a fan of physical therapy either. Are there any other options you can suggest? Spasiba, doctor. That means thank you in Russian. Thank you, Anastasia. So there is a myriad of treatments for back pain. You can lose some weight. You can get a massage. There's some electrical stimulation. You can correct your posture. Exercising helps, abdominal strengthening, lower back stretching, cold and hot therapy. But in my book, the best way to get out of this constant cycle of back pain is with an epidural steroid injection. A properly targeted injection where a drop of a medicine known as a steroid gets injected may take away the local inflammation, and all of a sudden you find that you have no pain. And you have no pain if you have no pain, but you have a degenerative disc, then you don't have to have that disc corrected. A steroid, common name for it is cortisone, is actually the best way to diminish inflammation. Hey, we got another question, this time from Facebook. It comes to us from Phil. And his question is, hi, Dr. Brusovanik. My father had sciatica, and now I've been diagnosed with degenerative disc disorder. Does this mean I'm going to get sciatica too? And what is sciatica exactly? All I know is that it's painful. Phil, thank you for reaching out. And good question, by the way. Before I answer your question, I want to share a quick video from the good folks at the Mayo Clinic.
The sciatic nerve is composed of multiple different lumbar nerve roots that come from the spine. Lumbar and sacral nerve roots, actually. So sciatica is a little bit of a misnomer because usually the problem that's causing pain down the leg is just the compression of one of those nerve roots and not that whole big nerve. Usually it's the L5 or the S1 nerve root, the fifth lumbar nerve root or the first sacral nerve root that's causing the problem and not the whole sciatic nerve.
So, Phil, check this out. You see all these nerves coming out of your back? And you see right here, there's a little channel where those nerves exit. That's the channel that sometimes gets compressed. Now notice that as these nerves course through your pelvis, I'm just going to gently turn this patient all the way to the back, and all these nerves come together here with the sciatic nerve. That's where the common term sciatica comes from. And to us, sciatica means pain that starts in your back and then goes down your legs. Now look, so many patients have it that it's impossible to blame it on your genetics, and it's not a dangerous problem. Now, that being said, sciatica is usually how patients end up coming to the doctor because the pain just becomes too debilitating. Now, sciatica is something possible in your upper extremities too, and that's where pain starts to go deep to the shoulder blade, all the way to the arm, and sometimes all the way down to the fingers. So if your father has it, it doesn't mean that you're going to have it, but so many patients get it. And if you have sciatica, you don't need to rush into surgery, although surgery can correct the problem. There are some really good solutions like those steroid injections I've mentioned earlier. If you have questions, we've got answers. And just in case you missed it the first couple of times, here's yet another chance to find out where you can send in the videos.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. The next one in the queue comes to us from Instagram, and that happens to be right up my alley. Vanessa asks, hi, Dr. Brusovanik. My husband is going to be getting a disc replacement. Good. Next month. And I'm very curious and maybe a little nervous about his upcoming procedure. I wasn't there when he talked to the surgeon, so would you mind walking me through the process? Is this safer and better than spinal fusion? Hi, Vanessa. Thank you so much for your question. Like I said before, this is really my sweet spot. I'd be extremely happy to talk to you through it and allay your concerns. I do disc replacements all the time, and it's lucky to be a spine surgeon in this day and age because I can truly cure back pain with disc replacement. But first, let's check out this video about disc replacement.
The diseased disc is removed and replaced with ProDisc L, which has a unique central keel to provide immediate stability to the implant. After implantation, ProDisc L provides height restoration, offloading pinched nerves. The implant provides controlled and guided motion, shown to be safe and effective over the long term.
So historically, if you had a degenerative disc, a bad disc that used to cause back pain and pain going down the leg, all we could really do was put screws above and below, immobilize that segment. The problem with that is that about 36% of patients would come back to have more surgery sometime later in life. Now, we know that we need to restore patients' height. The whole problem begins with losing disc height, and we know that we need to restore it. With disc replacement, and now that we've had over 20 years of good research and development, we have learned how to restore patients' height, how to open the space for the nerves without immobilizing the spine, without placing screws. Now, this can also be said with, this can also be done with a minimally invasive technique. So we can sneak in, remove the pathological disc, and place these devices that don't wear out, that stay in place, and allow one to get back to normal right away. I do this for professional athletes. I do this for mere mortals like myself. And it's shocking how patients can wake up and say that their pain is gone. If your surgeon is telling you that you got to have a fusion, it's possible, because if there's deformity, you may not be a candidate. But most patients are candidates. So talk to your doc if you're about to have surgery, about maintaining motion and about having a disc replacement. Our next question of the day comes to us through allhealthtv.com. So it's kind of fitting that we'll have another question through this wonderful website. Dr. Brusovanik, my brother had a tear in his rotator cuff and was thinking about getting surgery on it. But at 45, the doctor asked him if he was a professional athlete. My brother said he played softball on the company team, but no, he wasn't a professional athlete. Then the doctor said, why bother getting the surgery? Let me give you a cortisone shot. The shot worked like a charm, and that was that. Let me ask you this, what the heck is cortisone? What does it do? And can I get a shot in my lower back? I love this question, Kelvin. So most of my patients are surprised when they fly in to see me that I try to get them to avoid surgery. Cortisone is a medication that minimizes inflammation. We use it in the drops we put on our eyes, in clear eyes, for example. We use it, as your brother had, in his shoulder, and we use it all the time in the back. Now, if a disc degenerates, if it develops a fissure, you develop local redness or inflammation right behind that disc. And if we were to place very, very carefully, with the guidance of x-rays, a drop of steroid right behind that disc, between the disc and the nerve, in a manner called a transforaminal epidural, you may find that the pain just disappears. Now, everybody asks, how many of these can I have and how long will it last? Well, it's impossible to predict. I believe you try one and you see what happens. You don't need anesthesia for these. You don't need to go to sleep or go to a surgical center. These are very easy to do. And you really want to find the best specialist who does these injections all the time. Now, I work closely with a pain management doctor, and I actually derive some very important information from these injections. So not only do we use these injections to help you avoid surgery, we also use them to solidify the diagnosis. Now imagine you come to me with back pain, and after we obtain an MRI, we find that you have multiple degenerative discs. Now, if you have nerve pain, you can trace the nerve back to where it comes from and be fairly certain. But even in that case, you want to confirm which disc is the problem. So if we inject L45, for example, and then you tell me immediately after the injection that the pain disappears, let's just say in that scenario, the pain disappears but doesn't last. I will tell you with complete confidence that if we go to surgery, your pain will be gone. So we mix the cortisone or the steroid with a drop of lidocaine or a local anesthetic. So if you place that medicine in the right spot and your pain disappears, now you know exactly where that pain is coming from. And I would not dare rush into surgery until I certainly confirm where the pain is coming from. So to answer your question, Kelvin, these steroid injections are a godsend for so many patients, and they're a way to really be certain where the pain is coming from. Now, you can have these injections in your neck as well. The classic way to do these is with this single shot right in the middle of your back, where the needle penetrates the wide open area. But this is a classic epidural. It doesn't have nearly as much efficacy, and it doesn't really provide as much information as a transforaminal epidural. Sorry to nerd out on this issue, but if you're going to have an injection, make sure that you're going to get a transforaminal epidural. And if it works, then you know that if it doesn't last and you have surgery, your surgery will fix the problem. Well, that's it for this episode of Ask the Doc. I want to encourage you once again to please feel free to send in your questions via Instagram, via Facebook, via YouTube, or through Ask the Doc website. I really appreciate you sharing these personal questions with me. And even though I'm not, I don't try to